Hello, my name is Adil Ali, and today I would like to talk to you about pertussis, also known as whooping cough. I will explain to you what pertussis is, the causes of pertussis, ways in which to avoid pertussis, the symptoms of pertussis, the treatment for pertussis just in case you have pertussis, and I will also tell you what will happen if you have pertussis and you do nothing about it. So, what is pertussis? Pertussis is an infectious bacterial disease. This infectious bacterial disease can cause the person uncontrollable and violent bouts of cough. This can cause them also chest pain, and they may even cough blood after excessive coughing. This excessive coughing can lead you to have extreme difficulty in breathing. Pertussis is an airborne disease spread through respiratory droplets from coughing. So pertussis is mainly spread through a person's cough. So when a person has pertussis and they cough around someone that does not have pertussis, that person is likely to get pertussis through the cough of that person. So pertussis is very, very contagious. Pertussis attaches to the cilia of the nasopharyngeal. This releases toxins causing airways to swell, therefore affecting the ability of the person to breathe. Causes of pertussis. Pertussis is mainly an airborne disease. Also, an infected person with Bordetella pertussis can also help the spread of pertussis. Coughing or sneezing, spreading germs from one person to another, these are all ways in which pertussis is spread. So mainly when you have pertussis, being as hygienic as possible is the best way to stop the spread. The symptoms of pertussis are mainly coughing, sneezing, having a runny nose, fever, and having watery eyes. Preventions of pertussis are immunization, vaccination with a cellular and a whole cellular vaccine, antibiotics such as erythromycin and clarithromycin. Erythromycin is mainly an antibiotic useful for treatment of a number of bacterial infections. These include tract infections, skin infections, chlamydia infections, pelvic inflammatory disease, and syphilis. So erythromycin is very good for whooping cough. On the other hand, clarithromycin is an antibiotic used to treat various bacterial infections. This includes strep throat, pneumonia, skin infections, pylori infection, and Lyme disease. Clarithromycin is sold under a different brand name known as Biaxin in most countries. There are a few treatments for pertussis, like vaccination. Vaccination has two types of vaccines. One is a whole cell vaccine and a cellular vaccine. Vaccinations during pregnancy are the most cost-effective treatment for pertussis. Antibiotics such as erythromycin and clarithromycin work very well too, if you are diagnosed with pertussis. What can happen once diagnosed with pertussis and nothing is done about it? Well, mainly pneumonia can occur. You may have respiratory failure in both children and adults. It can cause mortality among children worldwide. Best ways to avoid pertussis is having vaccinations at a very early age, getting vaccinations during pregnancy for females, visiting a general practitioner, nurse, or healthcare staff on a weekly basis will help the prevention of pertussis. Thank you for listening to my podcast on pertussis. I hope you've enjoyed listening to this podcast as much as I've enjoyed making it. I also hope that you learned what pertussis is, its causes, and ways in which you can avoid pertussis. Thanks for listening. My name is Adil Ali, and that's it from me for now.